Hey guys, it's J. Michael Bennett here, and I'm over at Plex, which is a excellent physical therapy facility where they do sports performance, sports-specific training. And I'm just here to show you some basic exercises on what to do after surgery. Primarily, this is geared towards my patients that have had any kind of shoulder surgery. I just want to show you your sling, how to put it on, put it off, and really what you should be doing now. Once again, this is every surgeon is different regarding their post-operative course and the rehabilitation, so it's very important that you follow what works for your surgeon, okay? You do not want to go outside their specific directions, but in most cases, this is what I use with my patients in regards to any kind of shoulder surgery. And then also, in addition, we'll show you some exercises for instability as well for the shoulder. So I'll go ahead and start by showing you the sling. How to put it on, put it off, and then we'll go from there. This here is a standard abduction pillow right here that fits to the side, in addition to a sling. I like these slings primarily because they breathe a little bit better than some other slings that are out there. They're pretty snug. So as far as putting these on, really you start by just putting on your abduction pillow first. And it's an easy, once it's sized, it should snap on pretty easily. Then this frees up the other arm here, and just kind of slide in the sling itself. Okay. Obviously, you're going to need somebody to help you initially if you've had surgery before you put this sling on. There's a number of different parts, but once it's sized, it should fit you pretty well. Okay. Depending on the type of surgery, it's going to determine how often you need to wear this sling. Most rotator cuffs are going to be in the sling for quite a long, or for at least a couple of weeks. As far as exercise you can do in the sling, well, what I encourage a lot of patients to do, there's a ball here that comes out, and you can actually do squeezing exercises working on grip strength while you're in your sling. Depending on what kind of surgery you've had done in the shoulder, whether or not the type of tear, the rotator cuff, or whether or not the biceps was involved, will determine whether or not you can actually fire your biceps, because a lot of times this biceps tendon has been repaired and you don't want to fire the biceps. But if you can, and you're allowed to by your surgeon, you can unstrap your sling there and just kind of gently move your elbow. Okay? You're still keeping your pillow by your side, you're using it to support the elbow, but you can do some passive motion exercises with the elbow. And like I said before, if you've had bicep surgery, you want to make sure you check with your surgeon first if this is allowable, because the last thing you want to do is fire the biceps and end up stressing the repair here. So you don't want to do that if you had any surgery on the biceps. If it's just a straight rotator cuff, only the rotator cuff tendon involved, then passive motion of the elbow and even active motion of the elbow is allowed. In addition, you can rotate the wrist backwards and forwards, open and close the hand. And that's really it for the first few weeks. This shoulder is pretty much, for all intents and purposes, supposed to stay in this sling day and night. Okay? So just make sure you wear this at all times initially for the first few weeks until you start your program for physical therapy with your surgeon. That being said, when you take off this sling, really it's just a matter of just unsnapping a couple clips here, and then the sling's off, and then you take the pillow and you slide it off. Okay?